is Jenny Lauren Dowden for Conduit News, and today we have Dr. Amy Beard joining us. Of course, as many of you know, that she is a certified functional medicine practitioner and she practices in Little Rock. Hi, Dr. Beard.
Good morning, Jenny.
There's so much that we can talk about. I feel like I say that every time that you're here on Conduit, and there's just a laundry list of things to go over, but then we'd probably be here for 2 hours. So let's just jump right in right now to something that's happening across our state. UAMS, Kim Patterson, Arkansas Veterans Affairs, and a few others are testifying at the Arkansas Legislative Council. They're requesting permission to comply with the CMS mandates with their healthcare workers. What is your initial thought?
When is it going to stop? When will the emergency be over? We're at 2 years now, just shy of 2 years. Have you ever known an emergency to last 2 years?
Right.
And do these, just because you're a healthcare worker, does that mean you no longer have constitutional rights? Why are healthcare workers being treated differently than the rest of the population?
Yeah, what we're hearing in that meeting right now, it's, well, oh, we would lose, this much money, millions of dollars if we don't comply. And we understand that. However, and I thought this was a good point that Representative Ladyman said. He said, what is the number that we will sell our state for? Is it 600 million? What is it that we will essentially be selling our freedoms for regarding with the federal government and complying with something that's completely unconstitutional? And that's a great question. When does it stop? When will we say, you know what? We won't accept those funds?
I think part of the plan is to have it go on for as long as possible, because we know it's not about a virus or our health. Right. It's about something much, much bigger, our freedom. And they're taking our freedoms a little bit at a time. And I don't know, it seems to me like a lot of people just simply don't value freedom, don't appreciate it. And for some reason, I don't know why, believe the government and healthcare system has their best interest at heart. Follow the money.
Right.
I mean, you cannot, if you cannot understand history and then trust the government. It doesn't work that way.
One thing also
I do not trust. I just simply don't trust them, and I have many, many reasons why.
Right. Well, tell me if you find this comment to be trustworthy. Also, in this hearing right now, Kim Patterson from UAMS said, no exemptions have been denied under my watch.
I'm pretty sure that's not the case. And I've been hearing from too many that simply isn't true. So if you're listening right now and you've been denied an exemption, please step forward. We need to hear from you. We need to rebut this.
We recently talked about, we're seeing hospitals are now pushing remdesivir. They will receive a 20% bonus for using remdesivir. With what we know about that drug, how is this happening?
I don't know.
Why is the federal government pushing remdesivir above any other treatment right now?
Because they're controlled by the pharmaceutical industry. Everybody has sold out to the pharmaceutical industry. And it's not just our country, it's several countries, apparently. We know remdesivir is toxic. It's only being utilized under an emergency use authorization right now. It is not FDA approved. And we have even Dr. Merrick, who testified recently at Senator Ron Johnson's roundtable of physicians. He was talking about how toxic it is. And in prior studies, before they started using remdesivir, over 50% of the people it was being used on died. That is not good. And I have seen, and I have experienced this myself. The patients I told to refuse remdesivir are now alive. They're still alive. They made it home out of the hospital. But the ones that do get remdesivir either don't make it or they end up having kidney issues afterwards.
So how would you recommend if someone has a family member that is going to the hospital? We know that remdesivir is going to be pushed. What would you say to them? How can they properly deny that medication?
You can always deny a medication, always. And you just have to let your voice be heard up front from the time you enter the hospital, just like my father did.
Mhm.
My father ended up in the hospital for several days with COVID, but the first thing he said to them when he entered was, no vaccine, no remdesivir, no intubation. Now, they knew who his daughter was. So that makes it a little bit different. And I ended up having to talk to the doctor as well, who was very nice. He was at St. Vincent's. They treated my father very well. They were very respectful to him and to me, despite our differences in how we wanted to proceed with treatment. But that's not the case with many people. I've heard horror stories. I've heard people who actually told the doctors and the staff they did not want it, but ended up getting it anyway. So you're going to have to really stay on top of it. And everybody needs an advocate that is on that phone, talking to the nurse, talking to administration, talking to the doctor who's overseeing them, and having it on record multiple times that you told them you didn't want your loved one to get it. Because sometimes our loved ones are sick. They're you know, they're not, their cognition is not what it should be. And someone needs to be speaking on their behalf. You just have to stay on top of it. And it's unfortunate that, you know, they're basically treating patients like prisoners these days, keeping them isolated for days on end.
Yes, I've heard from several of my friends and family members who've experienced that, and it's so sad, and it doesn't make sense anymore. And I think that's why a lot of people need to be aware of a bill that recently was passed, went into law. Representative Mayberry, we've mentioned it several times before here, no patient left alone. And that bill was specifically for this pandemic, so that patients could have an advocate, so they're not left alone and isolated. And so if anyone has a family member in the hospital right now, they need to take a copy of that bill.
Yes.
And tell them, you know, we have a right to be with our family member.
And don't shy away. Don't let them intimidate you.
Yeah.
That is your loved one in there. They are supposed to be taking care of that person and abiding by your wishes.
Right.
Don't be afraid to get confrontational if you need to. Your loved one's life depends on you being their advocate. You have to do that. It's unfortunate that this is where we are in this day and age. I've never in a million years would I think it would come to this. And it's disgusting. And I don't know what it's going to take to bring some normalcy back, some true health care and patient-centered care back to our hospitals. It seems like it's just gone.
Yeah, I want to talk to you about that in a second, but also in the same vein of talking about incentivizing medicine, we're also seeing a lot of cities and schools incentivize the vax again. Lori Lightfoot in Chicago posted a picture, and, you know, it's like get vaxxed, and it's spelled out in dollar bills. Little Rock School District just approved a policy to incentivize their students. They'll give them $50 if they get vaxxed. Fayetteville, the city of Fayetteville, the Fayetteville City Council here talked about incentivizing the vax again. We're now, what, a year plus into having the vax, if not more. If people don't want to get it, they're not going to get it.
Hello. I mean, and why are we pushing this on kids who basically have 100% survival rate? This makes 0 sense. And I cannot understand why parents are doing this to their children. This is still experimental. We have 0 long-term studies, 0. And people are having adverse reactions to it. Even children, I know children who have heart problems now, developing pulmonary embolisms. Children.
Yeah.
We've
never seen it before like that.
Over a low risk.
Yeah.
It just makes no sense. And if a product works so great and it truly was a pandemic and people were, you know, just dying left and right, you would not need incentives. People would be lining up demanding it.
Right. I recently saw a news article about in the state of California. They are considering legislation for kids to not need parental consent to get vaccinated.
Well, we knew it was coming this way. They've always wanted control over your children, right? It takes a village, not parents, to raise your child. And they're basically pushing it. The state wants your child. They want full control over your child. And this has been going on a long time. This is nothing new, but you can see them move, just doing more and more and more to take more control away from the parent. And parents, you've got to push back. That's your child. That is absolutely your child. For me personally, it's not like the public school system is going to have a change of heart one day and go back to being normal. Okay.
Right.
So it's only I don't know why people think it's going to get better. Why would you think that? Look at what has happened over the past 2 years. It's going to get worse. And we have to, we've got to remove ourselves from the system. Right.
So earlier this week, the FDA announced they're revoking emergency use of the monoclonal antibody treatment. I don't think this comes as a surprise. The Arkansas Department of Health said that they welcomed and agreed with that recommendation. A lot of people are asking, why are we not using and utilizing everything that we have on the table to treat COVID? Why does it seem like the federal government is continuing to strip away anything that could possibly help, including the antibody treatment?
Money. Follow the money. And that is where you will find your answer. Mm-hmm. It's always been about money. So yeah, the things are honestly they want to deny the monoclonal, but use all these new drugs, right? That they've just happened to develop, that we know nothing about, don't have any long-term studies. They want to use those versus things that we have been using for decades and that are FDA approved. And we have tons of studies showing how valuable and effective they are. Cheap, very expensive.
Right.
There you go.
Do you ever, and especially talking to you about this, we're in year 2. Do you feel like you're in the Twilight Zone?
Every morning.
Where it's something else comes out, we're reverting back to, masks with the kids and the mandates. And it's like, what is going on?
Why do people keep complying?
I don't know.
Do people not have access to the internet? I'm really starting to wonder. Because the truth is, it's so easy to find all of the hard data from Pfizer's own studies. It's amazing how you have access to their own data, but what the media is pushing is completely opposite. Right. Of course, those headlines are what most people read, and they don't do their own research, and that's why we're here where we are.
You mentioned this earlier, and we've actually talked to you about this earlier this summer. What does it look like, unplugging from the matrix that is the medical industrial complex? People are waking up. People are realizing they can no longer trust their doctors, their physicians, these healthcare workers, for one reason or another, are not being honest with us. So what does it look like for alternate care, whether that is, and you've mentioned this before, some type of parallel healthcare system that will go alongside to give people an opportunity and a different option outside of these, big institutions?
Yeah, well, first of all, a lot of people have said we just need to change the current system. That's not going to happen.
Right.
Come on, let's be real here. So you've got to do something parallel. To me, the first thing that anybody could do is start taking better care of their health so you don't have to be dependent on any type of system.
Right.
Okay. And most people, believe it or not, guys, you have the power to do that. If you don't know how, I can help you. But that's one part, is just each individual taking better care of their health so that they don't have to be dependent on any system. But then we're talking about, and I've been talking to other nurses, physicians about what do we even do? I know the America's Frontline Doctors have started setting up their own clinics, right, across the country. That's a great step. I know other people who are doing the same. There are several doctors who have now set up house call businesses so we can go directly to your home and try to keep you out of the hospital or what have become prisons and death camps.
Yeah.
So there's a lot that we can do in your home to keep you out of such situations. Now, there's always going to be times when we can't, right? So we're never going to be able to really completely decouple ourselves from the system. We'll still need their, emergency rooms and trauma care and things like that. But we've got to start getting creative and thinking about how to do this on our own. There are places like the Oklahoma Surgical Center where they're cash only. They don't mess around with insurance and things like that. So they don't get in bed with those and don't have to follow certain guidelines. We need more cash fee options. And I know people are scared about that, but then we have to start thinking about insurance options.
Right.
Okay. Comprehensive insurance is a scam. And there are plenty of businesses and organizations offering catastrophic care. I have one of those plans, $72 a month. I pay cash for imaging studies, labs, what have you, but I stay pretty healthy. I work at it. I don't need to do those things. I don't buy medications. I get a routine lab checkup every now and then if I feel like I need it. But otherwise, that's the way we're going to have to start thinking. We've been duped into thinking that we need this system to be healthy.
Right.
And the system is actually making us less healthy.
Right. Okay. Well, talk to us about your practice, how people can get control of their own health. What does that look like? Where do they need to start?
So the first thing I would have you do is go to my website, amybeardmd.com. Every new patient has to sign up for a first step appointment with me. And you're going to fill out a lot of paperwork ahead of time, all about your life. We get all up in your business because we need to know about you, because that's how we know how to best help you.
Right.
But our goal is always to uncover and address the root causes of your health issues and help you understand how your lifestyle has contributed to that. So then once you understand that, you don't have to be, you can be free, right?
Right.
Free of the system, free of the pills, free of the procedures. And it's an awesome experience when you see the light bulbs go off in patients when they get it and they start living, they start making better choices, their problems go away, and they're free of the system. That's what we want.
Yes, we will provide that information as always. There's still a lot that we haven't covered, but is there anything else that you want to mention right now?
Oh gosh. Don't shut up. Don't comply. Keep spreading the truth. Keep pushing back. We have to. We are at a critical time right now. It's not going to get better. Complying it's only going to get more it's only going to create more mandates, more control.
Right.
You will never comply your way out of this. So you have to push back for your children's sake, for your grandchildren's sake.
Yes. And we appreciate you always pushing back and telling the truth.
You got it, girl. There's no other way for me.
I know there's not. Well, listen, we always appreciate having you on Conduit, and we'll see you again next week.
Sounds great, Jenny. You take care.